Myra. I'm going to be your student nurse today. I'm here to give you your medication. Before we start, can you confirm your first name, last name, and then your date of birth?
It's Evelyn Blake, and it's December 2nd, 1994.
Perfect. And then do you have any allergies?
Yes, to penicillin.
Penicillin? All right. Okay, so I'm here to give you your medications. We're going to give it to you through your IV. It's going to be some normal saline, and then we have some Triaxone for you. So that's an antibiotic that we're going to use to treat your urinary tract infection. I do know that you are allergic to penicillin, but since you haven't had any adverse effects with the medication that we've been giving you so far, we're just going to keep continuing giving it to you. All right, so I'll be right back to grab that for you. Do you have any questions for me before I go?
Yeah, what are some of the adverse effects?
Yeah, so it includes nausea, vomiting, diarrhea, and rash. So you just need to let us know if you experience any of those after we give it to you, okay?
Okay.
And then hand hygiene. Okay, so now I'm at my med cart. I have my MAR with me, making sure it's the right patient. And I'm confirming that she is allergic to penicillin. The first medication is the ceftriaxone, so I'm going to go ahead and grab it, and I'm going to pretend this is ceftriaxone, and it's 1,000 milligrams per 50 milliliters. I'm going to check the expiration date, and it's not expired, so this one's good to go. And then I'm going to grab the secondary IV set that goes with it. Next is the normal saline, and I'm going to check the expiration date, not expired. And then I'm going to grab the primary tubing, and then I'm ready to go to the patient's room. Hi, Mrs. Blake. I'm Myra. I'm back again to give you your medication. Let me just wash my hands real quick. All right. And then can you confirm your first, last name, and date of birth, and any allergies you have?
It's Evelyn Blake, and it's December 2nd, 1994, and I'm allergic to penicillin.
All right. Awesome. So I already let you know about this medication. How are you feeling?
I'm good.
All right. Okay. So first, I'm gonna do. All right. So again, I'm gonna check the medication with the MAR. It is normal saline. Check the expiration date. All right. And then I'm gonna. Oh, and then it's the right dose as well. Okay. And I'm going to make sure it's the right drug, which I just did. Check the integrity of the bag, make sure there's no rips or tears. Check the color, and it should be clear, and the expiration date, which I just did. All right, and then we're ready to go. We're gonna assume that I just opened this from the package, so it's clean, sterile. I'm gonna spike it. All right, so we are good to go. I'm gonna hang this up here. Untangle this. I'm gonna make sure that some of the saline flows into the chamber. And I'm gonna check, make sure there's no bubbles, check the clamps. This one's open, and then I'm just gonna prime the IV line, and I'm just gonna make sure fluid is flowing all the way through, and that there's no bubbles. All right, and then I'm gonna get my alcohol swab.
Did you clamp it again?
Yeah.
Okay.
I'm gonna scrub. Alcohol swab. And I'm gonna grab my patient's IV, and I'm just gonna scrub. and then I'm going to attach it. Okay. So I'm going to put this in. Okay, and then turn it on. Alright, and then yes, it's a new patient. I'm going to confirm, same profile. Check the patient ID with the MAR. It's 12334. And confirm. And then channel select. Basic infusion. Alright, and then the normal rate for normal saline is 100 milliliters per hour. So that's what we're going to put. It would be on the MAR. And then there's 1,000 milliliters in the bag, so I'm gonna set it to 950 so it can let me know when the bag's almost out. And then I'm gonna unclamp it and push start. And then I'm gonna check the chamber and see if it's dripping. That means it's going. Yes. Okay. All right. So next, I'm gonna administer the ceftriaxone. I'm gonna open the bag. All right, I'm gonna check the MAR. Make sure we're gonna pretend it says ceftriaxone 1,000 milligrams per 50 mils. And then I'm gonna make sure it's the right drug. Check the integrity of the bag. There's no rips or tears. Make sure it's clear. And then I'm gonna check the expiration date, and everything checks out. So now I'm gonna open this up. Okay. I'm gonna take this off. Okay. So it's good now. All right. So I'm gonna get an alcohol swab real quick. So again, just letting you know, you might feel some nausea, vomiting, might experience some diarrhea or get a rash. So just remember to let us know if any of that happens. Right, so I clean this. Attaching that. All right, and now we're back priming. Making sure there's no bubbles. And then I'm also checking to see if there's the compatibility of the drugs. Make sure that it doesn't change color or if any crystals form.
Okay.
So now I can grab my finger. And then we're gonna hang the ceftriaxone higher than the normal saline, so then that one infuses first. And then there's fluid in the chamber. Then I'm gonna grab the MAR. And then I'm gonna hit channel select. Secondary. I'm gonna reach down, check with the MAR, check with this. It is the ceftriaxone. And then confirm with the MAR, 1,000 milligrams per 50 milliliters. Confirm again, it's fine. Look at this one. Confirming again. Next. And then I'm gonna unclamp this. And push start. And then we're gonna check to see drips. Okay. and then I would come back in 30 minutes to make sure that she's not experiencing any side effects, and then I would keep an eye on her lab values to make sure that the antibiotics are working. Okay. So I am done giving you your medication. I'm going to be back in 30 minutes to check up on you, but my pal Jennifer is going to be coming in to insert your catheter for you. Do you have any questions for me before I go?
No.
All right. So then I'm going to perform hand hygiene and then exit the room.
Hi, Mrs. Blake. My name is Jennifer, and I'll be your student nurse today. And how are you doing today?
Good.
Good. Okay. Verify your full name and date of birth.
My name is Evelyn Blake. My birthday is January 2nd, 1994.
Okay. And the reason I'm here is to insert your urinary catheter. I see that you already have your antibiotics and your saline running as indicated on your MAR, but due to the fact that you have a UTI, you might be experiencing some increased urge in urination or painful urination. So inserting a catheter might make you feel a little bit more comfortable while your antibiotics are working. Is it okay if I insert your catheter now?
Yeah, sure.
Yeah. Okay. So let me just go ahead and grab some gloves. And have you had a catheter before?
No, I haven't.
No? Okay. So what I will be doing is I'm first going to clean your vaginal area with some soap and water, and then go ahead and insert your catheter and collect some urine sample. And I will be exposing your private part, so I'll try to work as fast as possible to get through it, okay? So I have clean gloves on. I already performed pericare. Now I'm going to move on to opening my kit and doing the procedure. So, and Miss Blake, are you allergic to anything?
Just penicillin.
Penicillin? Okay, doctor, that's what I have on your MAR. So I'm going to go ahead and begin the catheterization process. I'm going to go ahead and place this catheter kit in between your legs and just try not to move because then we would have to start this process all over again. So is that okay with you?
Yeah, that's fine.
Yes? Okay, so I'm just going to have you bend your knees and open your legs so I could go ahead and do the procedure. Put the head on the bed a little bit to make you a little bit more comfortable. And raise the bed a little bit. There we go. So I'm just going to go ahead and check the kit, check the expiration date. It is not expired. Okay. And I'll make sure I have all my supplies. I don't need one of those. So I'm going to go ahead and begin. I'm just going to go ahead and roll this up for you. And there would be a waterproof pad under you. I removed it because I did pericare and it got all wet. But now I'm just going to go, I already checked the expiration date, and I'm just going to open my kit. Oh, and I also checked the integrity of the bag. And I'm going to go ahead and place this in between your legs. Just try not to move me, okay?
No, I was just laughing about that. Yeah.
I'm ready to begin. Okay, take that out. Oh my god. She did. So now I'm going to go ahead and remove my gloves and put on my sterile gloves. And there's a trash can right here. So I'm just going to grab them. And I'm going to put them on the base of the bed. had to go up. Discard that. Okay, so now I'm going to go ahead and place this sterile pad under your, or not under your legs, but like, yeah, under your legs. I'm just gonna go ahead and place the sterile pad, and make sure that I put the glossy side down, like so. Now, I'm going to go ahead and place this pad right over your hips, just to, so I have like a hand rest. Okay, and now I'm going to go ahead and remove this top tray and put it right here. Now I'm going to go ahead and open up my lube and have it ready for me. Okay, do you have any questions?
No, I'm good.
I'm just going to go ahead and place it here. Discard it. I'm going to open my steriles, my swabs. Have them ready. When I do it. Leave them here. Discard. I'm going to go ahead. So I'm grabbing my syringe, and I'm going to go ahead and attach it. And just have it ready. Okay, I'm going to remove the packaging. Discard it. And I'm just going to have it resting on the lube just so that it lubricates. Like so. Okay. And now I'm going to go ahead and touch your vaginal area. And I'm going to come in with my right hand. Like so. I'm going to clean from side to side and then the center, okay? So I'm first going to start off by cleaning the right labia minora, discarding it, the left labia minora, and then cleaning the center. Okay. So now I'm ready for the insertion of the catheterization. Are you ready, Ms. Blake? Yes. Okay. Okay, so urine's already coming out, and I would go ahead and push in another 2 inches, depending on hospital policy. And now that it's in place, I'm going to go ahead and hold it and okay, so it's nice and ready. I'm just going to go ahead and pull on the catheter to ensure that it's in the bladder, and it is. And now I'm going to go ahead and attach the catheter onto the patient's leg. I'm just going to go ahead and place this on your thigh. Okay, and then attach. I'm going to push it, okay, and it's in place. Now I'm just going to go ahead and label this with my initials, the time and the date that the catheter was inserted, and I would go ahead and put it on a fixed area of the side of the bed, and I'd go ahead and collect my urine sample. I'd also go ahead and put the patient's name, date, room number, time, and so I'm just going to go ahead and fix it here. So, hi, good morning, Miss Blake. Do you remember me? I was the one that inserted your catheter, And may I please have you verify your full name and date of birth?
Evelyn Blake, January 2nd, 1994.
Okay, thank you. Okay, so it's time for me to remove your catheter. Do you have any questions for me
No.
before I do it? Okay, so let me just go ahead and begin and get this over with. Okay, I'd go ahead and put on my gloves, and then I'd empty out the bag with any urine that you might have, and then go ahead and dump it. And now I'm ready to go ahead and remove your catheter. This process is rather quick. It should not hurt, but if you feel uncomfortable, then just let me know. So I'm just gonna go ahead and place this under you. It would be a waterproof pad. Yeah. Okay. So I'm gonna go ahead and remove the stat lock. Like so. Garbage. Okay. Now I'm going to go ahead and attach my syringe and deflate the balloon. Okay. I'm going to go ahead and remove it, discard it, and now I'm just going to go ahead and remove your catheter, okay? Okay, I'm going to wrap it in my glove. Hold it. Wrap it. Okay, and grab the bag. And go ahead and throw it away in the nearest receptacle, which is right here. I'm gonna go ahead and remove it, discard it, and do hand hygiene. And the recorder's now. Okay. And now, okay, Miss Blake, I'm just gonna go ahead and lower your bed. Like so. And if you have any questions or if you need anything, just use your call button, and we'll be here to assist you. Okay? Everybody do hand hygiene out.